7:16 now. The holiday season is upon us, and that means parties, gatherings, lots of fun, and the chance of getting sick. It comes at a time when Louisiana ranks among the highest in the country for flu. Dr. Reena Mehta joins us with some tips for staying healthy in this season. Good morning.
Good morning.
Well, I guess that, that is the thing. If you interact more with people, more interaction means more illness.
Yes, exactly. I mean, the more you come across people, around people, the more people are sick and the more chances you are to get the flu and other respiratory viruses.
Now, in your other life when you're not here, like in a half an hour from now, are you encountering a lot of flu patients?
A lot of flu patients. So flu is rampant. So in Louisiana, we have one of the highest flu activity compared to the rest of the country, 3 times higher than where we were last season even. And so flu activity here started the end of August and it just continues to rise. We're almost at the peak this year compared to where we were last year.
I always try not to preach to the viewer who's smart, but I know you will tell us get vaccinated.
So the number one way to prevent getting the flu, and I know this can be controversial, but the number one way to prevent getting the flu and getting others sick is to get the flu vaccine. And the flu vaccine is recommended for anyone over 6 months of age. It is really critical for those who are at higher risk for getting complications from the flu, such as young children, babies, pregnant women, and elderly, to really get the flu because it can minimize the risk of having serious complications.
Well, and I know that's what doctors talk about is the herd health, or the herd immunity, that it's not just about your own personal health, but it's about the 5-month-old child who can't be vaccinated, or the elderly patient who might be very susceptible.
Exactly. And last year in Louisiana, we had 16,000 hospitalizations from the flu and 1,500 flu-related deaths. So with flu starting this early in the season, we have no idea what the season has in store for us.
I want to emphasize that. We had 1,500 flu-related deaths in Louisiana alone.
Exactly. And right now, with our flu activity at the rate that it's going, we are way higher than we were in previous seasons, which is scary because we have no idea what the season has in store.
How much pushback do you get, Dr. Mehta, from people saying, I'm sorry, I just don't like that flu shot, and I'll just take it, I'll take the risk myself?
A lot, actually. Louisiana has one of the lowest rates of immunization. So the Office of Public Health has actually reported that only 25% of healthy adults have gotten their flu shot this season so far. So we get a lot of pushback. I will say one of the biggest things I hear is the flu shot actually gave me the flu, and that is false. The flu shot is not contagious and it is not infectious. As any vaccine, you can have some local site reactions or some mild side effects from getting the flu vaccine, but that usually goes away in a couple of days.
I know we've had doctors on the show too who will say, look, a lot of people haven't had the flu. They think they had the flu. They got a bad cold. If you have the flu, it just knocks you.
Exactly. You almost always have a fever, and it can make you very, very sick. And actually, what's interesting about this year's flu is that it's influenza B virus that's so active right now. That's usually one that's not a big player. It's usually at the end of the season. This year, flu B is hitting children way harder than adults. And actually, 7,000 cases of flu was reported at Ochsner due to flu B last month.
One of the leaders in the country. All right,
yeah.
Dr. Reena Mehta, thank you as always.